Good evening, and welcome to the Ombudsman Program. I am Diane Welborn, and I am the Ombudsman for Montgomery County, and I am thrilled to be presenting this show to you this evening and on the eve of Veterans Day, where, of course, we honor our veterans from all wars that have served our country. And we at the Ombudsman's Office have a special program that my colleague Chip and I are going to bring to you. But let me first invite you to call in if you have any questions about our subject for this evening. This is a call in program, and so we'd love to hear from you. The phone number is 937 223 5311. And normally that's available at the lower part of your screen. And so you can see it there, but I'll remind you as we go through the program. I am joined tonight, let me introduce my colleague and the director of the Long-Term Care Ombudsman Program for our office and for 9 counties in Ohio, for all of the residents of long-term care, an advocate and a helper. But we have a special program at the Ombudsman's Office specifically designed for veterans. And because this is on the eve of Veterans Day, we thought this would be an appropriate time to remind our viewers that we do have this program for veterans so that they can reach out to us and talk with us if they have concerns around the care that they're receiving as a consequence of their service to our country. And it might have not yet really been completely analyzed, or it may have progressed or may have changed as things do for all of us. So Lawrence Wilkins, commonly known as Chip Wilkins,
Yes.
is our long-term care program director. Welcome, Chip.
Thank you. It is just an honor to be here, and I look forward to this opportunity. I've been thinking about it all weekend and really excited to share with the viewers the ins and outs of our special veterans program.
Yes, and thank you for agreeing to do this tonight because it is relatively new. Our ombudsman office has been in existence since 1971. So there are a lot in our people in our community that know about us and that we hope have benefited from the services that we offer, both in resolving complaints about government agencies and then also resolving concerns about care facilities and assisted living facilities and group homes, or just getting information from us at the office about the path to take to resolve some of their problems. Because ombudsman is a Swedish word, it's not often commonly understood because it's not a word that is used a lot in our society. But we're glad when people find us and when we are able to assist them. And tonight in particular, we're going to focus on what we can do for the veterans and actually also for their families that live in our community. And we think it's a lot, but if it matches the needs of any of our viewers, please feel free to call in tonight and pose a question to us, or to call us in the office at 937-223-4613. If you don't have the ability to call tonight or if you think of a question later. I know that's something I often do. I may not have a question immediately, but later in the week something will come up and I'll think, oh, let's ask about that. So, Chip, why don't you give us an overview of the veterans program that we have within the context of our long-term care ombudsman work? Thank you.
You bet, gladly. And I'd start off first by saying we are going to focus on the veterans program, but we at the Ombudsman's office, we really do hold veterans in the highest regard. We have a veteran ombudsman specialist. His name is Jimmy Gillespie, who is a veteran, and he is typically out meeting with veterans and working their cases. But I will tell you that even what you hear tonight about the veterans program, we will help all veterans with any long-term care issues they may have. We'd be happy to discuss, specifics about different facilities and what is best, whether it's home or assisted living or nursing home. We'll talk with veterans about any of these issues, but tonight we're going to focus on what is called the Veteran Transition Program. And as many of the folks in long-term care most are on what's called Medicaid, which is state public assistance. And when the funds run out, Medicaid takes over, and uh, that is a great benefit. However, when that happens, and most people don't know this because you're not dealing with Medicaid yet, but when you go into a nursing home and you have Medicaid pay for it, they also want the individual to pay all of their income to the facility. So they get $1,000 a month in Social Security. They want that thousand to go to the nursing home, and then Medicaid will pick up the remainder. And that makes sense because we want to minimize as much as possible the Medicaid as a resource because it is based on tax dollars. However, the veteran or the individual who is on Medicaid and gives their money to the facility, they do get to keep some money. Under the current state of affairs, it's $50 a month for their personal needs. And so you can imagine that does not go very far. In the veterans program, what is really powerful about the program is the fact that the veteran, if they qualify, and we'll talk about that, but if they qualify, they then can leave Medicaid or not have to use it altogether. And the Veterans Administration will pay for the nursing home. And in doing so, the veteran does not have to turn their income over to the facility. The nursing home or assisted living is paid in full by the Veterans Administration that we call the VA, and they will pay the entire bill. The veteran gets to keep their income, and that has just a profound impact on the lives of the veterans and their families, and we'll share some of those stories tonight. But the idea is that you get the veteran off of Medicaid into VA funding at the nursing home. There are some requirements. I mean, the veteran will have to, if they're not in a VA contracted nursing home, they will have to switch to a VA contracted facility. In our region, in Region 1, I think we have 14 VA contracted nursing homes, and that's where our VA ombudsman would help the veteran choose the right facility for them. But then there are also the federal veteran homes, beautiful facilities, and there's four of them in Ohio that are solely operated by the VA, and we'll talk some about those as well. But that's kind of an overview of the program. You have to go into a VA contracted facility, but the veteran gets to keep all of their income. One other requirement, and this is a pretty big one, is that the veteran has to have uh, a disability that's connected to their time serving. So we call it a service connected disability, and it has to be at 70% or higher. They like in the military put percentages on things, and they can tell you if you've got a disability what percentage that is of your total ability. And so you do have to have that 70% or higher service connected disability. But Diane, that's kind of an overview of the program, and we can dive deeper into any area you want to.
Okay, well, that's very helpful as that overview, and I think that the majority of our viewers who have a connection, a relationship to military service, understand clearly what you're talking about. For some viewers who do not, then they may not know these terms about the percentage of disabilities and how that kind of gets tossed around. But in military speak, it's pretty familiar. And then also the 70%. I mean, any person's disability, of course, can change over time. And so even the origin of it can progress. Things can change for people, and they can get better if they get appropriate therapies and certain help. I've always found it interesting that the therapies that are available in the veteran facilities are improved from the therapies that are available in Medicaid paid facilities. So you might say a little something about what those are. That's another increased benefit, an add-on, if you will.
Huge benefit that the VA provides to veterans. And I think everyone understands that in nursing home care, there are uh, rehabilitative services that are there for individuals. Most of us know physical therapy that is available. We've all had family members or friends go through physical therapy. Well, there's also speech therapy, there's occupational therapy. There are many forms of therapy related to a mental health diagnosis, such as PTSD, which is common amongst veterans. And the VA will provide these uh, therapies for veterans, and really they are reluctant to limit how much therapy a veteran can have. They really want the veteran to feel like they have reached their maximum improvement. Whereas many times with Medicaid, you will see that someone will go through physical therapy and uh, they'll be denied uh, further therapy after 6 visits because somebody reading the records back at Medicaid headquarters believes that the individual has reached their maximum improvement. And you don't deal with that as a veteran with the VA anywhere close to what you do with Medicaid. And so it is a huge benefit with, I wouldn't say limitless services available, but uh, most veterans will get the care that they need for as long as they need. And when there are mental health therapies involved, uh, those go on even longer, some indefinitely. So the therapy that's available for veterans is really outstanding. And regardless of whether someone is connected with the program, the VA transition program, I'd encourage all veterans, even younger veterans who are at home, if they think there's a need for therapy, to reach out to the VA because they have great therapy options available.
That's wonderful, Chip. Thank you for highlighting all of that. We have a caller, and just
Ooh,
to with a question, and I'll give that in just a second. But I wanted to let viewers know that you all don't get to hear the question directly from the person calling in because we're on Zoom. So the way this is working for us is that when one calls in, you're talking to the friendly volunteers at DATV, and then they write the question to us so that we can do what I'm going to do just now. So the question that we have coming in is that a veteran has asked if the ombudsman can help them with their diagnosis because he or she believes that the doctor's diagnosis was not helpful. So, Chip, can you enlighten us on that question, please?
I sure can. And to answer it, let me start by letting the viewers know that when a veteran discharges from the military, they go through a series of events, and one of those that they go through is an examination to determine their disability at the time of discharge. And uh, some veterans will come out with 0% disability, but most end up between 10 and 20 uh, percent disabled, and they'll connect it to the service that the veteran provided. And then later in life, let's say you discharge after 8 years, and 20 years later, your heart condition that was related to exposure to something in the military has gotten worse. You then go to meet with your doctor for a new evaluation. Usually, this is done at the VA hospital or medical center, and you go there, you're examined, and the doctor comes back and says, well, I think you're still at about 10% service connected disability, no change. And you, as the individual living with it, know that it is much more severe than when you discharge. It's affecting every aspect of your life. At that point, you can absolutely go for another evaluation. But how do you do that? You can't just go to your family doctor and do it. Couple of ways. One, you can, if you're looking into long-term care, you can certainly contact our office and we will help in guiding you through the process. But the other way you can do it is every county has a veteran service officer or a VSO. And if you contact the VSO, they and let them know that you want a second opinion evaluation, or it may be your first one. You want an initial evaluation post discharge, and the VSOs will help you schedule the appointment, will give you some understanding of what's going to occur during it, and then there will be a follow-up appointment with the veteran service officer after you complete your examination. So you absolutely can and should get another opinion from a physician if you do not believe that the evaluation done by the VA physician matches your expectations.
Right. Thank you very much for that clarification. Does the person that wants that clarification have to go to a physician that has some certification with the one of the armed forces or not?
Well, they need to be a medical doctor, an MD or a DO.
Right.
There are provisions with regard to understanding the military paperwork, and they have to be able to be competent in filling out the paperwork, and they can get a VA certification for that. But that's really about it. And the ombudsman or the veteran service officer will 100% get the veteran in with a physician qualified who can do that.
Wonderful. And we have a related question here about income qualifications.
Ah,
I think, but we should probably explain to our viewers that Medicaid, of course, is the program that provides medical coverage for people of low income. Medicare, of course, is the one that is for older adults, 65 and older. And many people do get that confused, and there's no shame in that at all. But with Medicaid, there is an income limit. But please talk about how that relates to the veterans
sure.
program.
And there is many folks hear Medicaid and they make the connection with low income, and that is the really deciding factor if someone qualifies for Medicaid. It is based on income. However, I will tell you, in the world of long-term care, um, we see folks every day who are now on Medicaid because they have expended all of their savings. And the long term care world is not cheap, it is expensive. And folks who have had, lots of money saved up, six, seven figures saved up, that when you're in a long term care facility for many years, it will add up quickly. And it does force some folks to have to turn to Medicaid to help cover the cost. However, when we're talking about the VA program and whether a veteran can transition to the VA paying for their care, there is no restriction or limitation based on income. Whether you earn zero a year or $100,000 a year, you could still apply for and be granted access to the VA transition program. The real key factor is the connected disability, because we as a country believe that if a veteran is disabled because of their service to the country, that the care that they will require as they age related to any injury or affliction they sustained while serving should not be something that the veteran has to cover the cost of. I mean, they've already covered the cost with the disability. They shouldn't have the financial ball and chain as well. So income will not restrict anyone from the VA transition program.
Yes, and I should add that income does not interfere or count at all in services from the Ombudsman's office. We do not charge anything for our services at all. And that's not something we take into account. Often, if we are helping people obtain other government services, that's where the income comes in, and people may have to qualify for other things. A lot of the programs that are, in the news right now, that I'm sure viewers are aware of, but there's no income qualification for our office or for veterans inquiring about any of those services through our veteran transition coordinator. And we have another caller that is asking where can they go if they have more questions when we're off the air and we're not here to answer them directly. And will an ombudsman come out to visit them or answer their questions? So, yes, yes, and yes. But I'll let you say more details, Tip.
Well, that is, we we absolutely will go wherever the veteran is located. Our transition specialist, Jimmy Gillespie, has gone from one side of the state of Ohio to the other many times to go and meet with a single veteran. We will do that uh, every day of the week if we had to, the work week, and we would make that journey to meet with the veteran to discuss the program and to see if that is something that is a viable option for them. Because at the end of the day, if a veteran wants to participate in the program or if they don't, um, that is okay. Our job is to make sure the veterans know what options are available, and then the veteran needs to make the best decision for themselves. And you may ask, why would a veteran not want to keep all of their income? Well, there are some occasions where the veteran has been at a nursing home for a year and a half, and they're close to where their family lives, and they get regular visits almost daily, and they're comfortable in that setting. They may not want to have to move to a VA contracted facility, but at least they know the options available if they decide that that is later better for them. And Diane, when it comes to questions outside of the show here, I think that folks could call us at the Ombudsman's office, and uh, I believe that you said it, but I'll say it again. That number is 937-223-4613, and we are there Monday through Friday.
Right. Thank you very much. You had mentioned we've talked about the choice, the importance of choice. That this is something that the veteran must decide if they want to move, if they want to relocate, in order to either keep more of their benefits as a veteran and pay less to the nursing home, which can help the family, and or if they need to be close, as we all want to be close to our families. So could you talk a little bit about where some of the facilities are in Montgomery County or in the close surrounding areas? We don't have to go through all 9 counties. People couldn't
Sure.
write that down that fast, but just give us a few that you think people may be familiar with and may not know that they're veteran certified.
Right. We have a couple of facilities right here in Dayton, One is a large nursing home, Riverside, in the Dayton area. There's also the sanctuary at Wilmington Place, which is uh, both are facilities that are located within the city limits of Dayton. We do have a in Springfield a facility at Southbrook, which is I think our largest facility that is VA contracted in Springfield. We have a facility in Miami County, and then we do have one in Preble County, and I will tell you, I think we may get a second uh, uh, facility that is waiting for final approval. The nursing homes that end up being a VA contracted home, they have to go through a long certification process. It usually takes up to a year to get the approval by the VA, and then the facility has to allow the Veterans Administration to come in and do their own inspection to make sure that the facilities are meeting their high expectations. Um, so they, along with the Department of Health, would be doing reviews, or we call them surveys, at these facilities on a yearly basis. So the VA contracted homes are being carefully monitored by both the state and federal government to make sure the veterans receive the best care possible.
Right, and that really cannot be stressed enough. That monitoring and oversight, while we don't do that in that type of capacity, we're constantly doing that as we visit all the facilities and as we are accepting complaints from people and talking to them. So we're a part of that network, even though we're not the enforcers and we're not the finers. We don't give people any fines for things, but we watch carefully to see how a facility looks, how it smells, and how people are being treated in there. Um, if a if another if a viewer tonight, because one has called, if they have a relative and this program may spark some interest for them, and whether their relative in another area might benefit from this program, even though they don't live right here in our jurisdiction, we can still take a call from them and we can still get them connected. Would you like to say a bit about that, even if they're not here?
Sure. The caller or anyone who may have a loved one in another area, let's say for now in Ohio, we will be able to connect the caller with the ombudsman in, uh, let's say the individual lives in Cleveland. We have an ombudsman transition specialist in the northern half of Ohio, and all the caller would ever have to do is call us, and we will connect them with that ombudsman so that their loved one can be evaluated for the program. But if there's ever any doubt in what needs to happen, any of the callers can call our office and ask for me, Chip Wilkins, and I will get them to the right people that they need to talk to so that they are given the best option or opportunity for success.
Okay, thank you, Chip. Can you can you give us a story or two about some of the veterans that have become informed of this program and have chosen to transition and what kind of benefits they may have experienced?
Absolutely. I think of first a veteran that uh, came to us in 2022 that at the time was at 40% service connected disability and wanted to know if there was anything that could be done to help because his wife still lived at home, and they had now a his daughter had moved back home with their her child, their grandchild, and the veteran was very concerned because his income was coming to the point where he was going to have to transition to Medicaid. And if he gave all of his income to the facility or the amount that's required, uh, he and his wife would have lost their home because they were still paying on a mortgage, and they were in dire straits. I mean, the gentleman was ready to move back home, even though the care required really was not appropriate for home life. So he was still 30% below the disability rating that he needed. Remember, we got to get him up to 70%. However, he had not been reevaluated since 2001, and his uh, disability, one of which was diabetes, which was and Parkinson's, both of which was directly related to Agent Orange exposure in Vietnam, where he served. So we were able to really fast track getting this individual in to see the doc to get a new evaluation. Ultimately came back at a 90% service connected disability. Um, while we were waiting for that for the decision from the doctor's evaluation to come back, we went and looked at a lot of the facilities that were VA contracted nursing homes. Uh, they had decided on a home where the veteran was going to go. Sure enough, when he got the word that he was at 90%, they moved to that facility. And the veteran and their family were uh, so thankful, but really just were relieved because the veteran knew his wife was not going to have to sell their home, was not going to have to move the daughter and grandchild and his wife to a unknown location, and what was really a scary situation for the whole family. We were able to at least give them an option of what could be done, and in that case, the move to another facility was not even a question for this veteran because he would have gone uh, just about anywhere if he could make sure his family was cared for. And that is a example of that has come across our desk so many times where you may not be losing the home, but to be able to care for your family and not have to give up that income to the nursing home is such a huge benefit that the for some the idea of being able to care for their family will trump any of the other options.
Understood.
One other story I have to tell because Jimmy would be
Okay.
upset if I didn't.
Then let it come. Let it
All right.
go.
There was a gentleman who had uh, gone and was examined at the VA back in 2012, I believe. And at that time, his condition, which was related to his heart, was found to be at a minimal percentage of disability, about 30%, I believe. But the individual was uh, having all kinds of trouble breathing, along with their heart condition, and they ended up having to uh, retire early. And we were just shocked that his service connected disability was so low. So Jimmy, along with the VSO, met with the veteran, said, there's something wrong here because you've been greatly impacted and your disability is so low. Um, they had another evaluation done, which of course came back with the veteran at 100% service connected disability. And then it was made retroactive to the 2012 visit because the condition and a lot of the uh, effects on the body were in place back in 2012. And so the uh, Veterans Administration had to write out a close to $300,000 check to catch up those years of non-coverage, which of course made a huge impact in this veteran's life, um, some of which included having to pay back medical bills, which he was really worried about because he had some specialists outside the VA that he had to see. But it was a truly life changing event for this gentleman and really for anyone involved in the case. It was just such a heartwarming story and couldn't have happened to a nicer person, really.
No, that's truly wonderful. What a great example. Yes, that one had to be spoken about. Thank
Yeah.
you, Chip. There's another caller with a question asking whether or not a person is better off in a veterans facility or in a long-term care facility. And everyone's needs are different, and every facility has perhaps slightly different services they can provide, but I'll let you take the answer to that. These things are very individualized.
So true, Diane, and really the hospitalization versus nursing home is even in the VA world, there are still very similar considerations, and if they typically will not send someone to a nursing home until they're medically able to go from the hospital to the nursing home. If the veteran is able to transition from the hospital to the nursing home, that is certainly something that they would want to consider doing because there's in a nursing home setting, there's not nearly as many restrictions. There are a lot more restrictions than, say, in assisted living, but not like a hospital.
Yes.
Um, and so I think that they would want to try and move from a hospital to a nursing home when they safely can do that. But again, that's a decision for the veteran to make in consultation with their doctor. And if they believe that they can transition to nursing home, they absolutely should.
Okay, great. Um, the How many veterans do you and our transition coordinator, Jimmy Gillespie, how many do we think are out there that might need to be informed about this option to go to a VA facility, but they just don't know about it? Because if my understanding is correct, it's not necessarily always asked when a person enters a long term care facility if they even are a veteran. So, what's your best guesstimate about that kind of thing?
Well, I could easily say there are thousands, probably tens of thousands, and I'll explain that. There are many veterans in nursing homes right now on Medicaid who may very well be a candidate for this transition. However, you're right that it is not always asked when someone admits to a nursing home, are you a veteran? If they did ask that, we can use a software system that we can't, but Medicaid can, that will target individuals who are veterans and on Medicaid. We could then send out information to those individuals, but sadly, we do not capture maybe 25% of the veterans who go into long-term care facilities are properly identified as veterans. But it doesn't stop with just the veterans in nursing homes. There are many individuals who are considering long-term care who may have a family member unexpectedly in long-term care, but whenever that thought of planning for long-term care comes to mind, that's when the program should be considered as an option. And veterans in particular should look at all of the long-term care options available to them, because even assisted living options are available to veterans that a non-veteran would never be able to look at. For instance, Georgetown in Ohio has a beautiful uh, veteran-run nursing home, but it also has an assisted living facility with it. There's one in Sandusky that is just gorgeous on the lake, but it has a nursing home and assisted living. And so there's waiting lists to get in there, but only veterans can apply. And so I think that the time to start planning uh, for long-term care is also the time to ask, what do I have as an option if I'm a veteran? So when you consider all of those populations, you can see where it's easily in the thousands.
Well, and I want to make sure the viewers understand, and Chip, you can elaborate if you want, that that type of planning is something that our office can assist with in talking about the options for the future. We find that a lot of individuals do not plan for life going into a long-term care facility. Of course, there are a lot of people that buy long-term care insurance, but usually it happens in some kind of crisis. And usually there's an accident or something, and the individual ends up in a hospital, at least initially, to get stabilized and then rehab in a nursing home or something is what's recommended at discharge. So oftentimes the route that people take to go into a nursing home is not as organized and as thoughtful as one would wish, just because of life events.
Right.
And so it's important to uh, what planning you can do to be in the future where you want to be. People can call our office and ask about those things.
They sure
And
can.
we help provide what we call this selection assistance. So, Chip, you can say a little bit more about what a person would go through if they want to contact us rather than calling up and saying, my dad or my mom now needs to go to a nursing home. Which one do you think is best?
Right.
So,
Right. Because as ombudsman, we're not allowed to say that we favor one facility over another. We need to stay objective. However, what we do have and what we do with most calls, whenever someone has a question about what facility should they select, we'll be on the phone with the individual, and we will have them, if it's an option, go and uh, Google, they'll do an internet search for the Ohio Nursing Home Navigator. And we will then walk through that with the individual on the phone, and show them how to use the Ohio Nursing Home Navigator. And one of the options is you can look at any nursing home in Ohio. You can look for nursing homes within a specific city, zip code. You can also look for uh, facilities that may have dialysis or that may offer ventilators. You have other options that you can use to find a specific facility. You can identify whether it's a VA contracted home or a veteran specific home. And you can go through there and then find three or four facilities that match your criteria. And literally, you can compare them all on one page. And one of the really cool aspects of the navigator is that you can then see if the facility has been cited by the Ohio Department of Health, or by the VA, but you have to dig for the VA. So we'll leave that for later. But definitely can see the citations from the state of Ohio, and the fewer citations, the better.
of course,
And
yeah.
so remember, you're looking for facilities that don't get many citations, because every year they do an annual survey of every nursing home. They go in for 3 to 5 days and do a really comprehensive evaluation of the facility. But at the end of it, there are, for some facilities, they get cited for certain violations, and then they have a plan of correction they have to do and get within the guidelines. But it's good that that information's at our fingertips through the Ohio Nursing Home Navigator. So you really can do as deep a dive into the facilities as you want, or that might not be what you're looking to do. You just want to know if it's close and has good rehab. So all of that you can find on the Navigator.
Right. And you can get to the navigator by calling our office.
That's right.
And we'll be happy to direct people there, because many times people don't know it until they need it.
That's
And then when they need it, when we need things, we have to figure it out right away. and do it. So we are there to help with that. Chip, our time is flying away. It's not over yet, but we have a few minutes. So I'd like to ask you if there's something we have not yet touched on that you think we really want people to know about the Veteran Transition Program or just in general.
Thank you. Yeah, I think, Diane, the most important thing I want to uh, leave the viewers knowing is that a veteran should always check to see what long-term care options are available to them that may not be available to the general public. Having said that, don't ever, as a veteran, please don't ever let your percentage of disability that you have restrict you from trying to uh, learn more about the uh, program to transition to a VA contracted home because uh, we have seen so many times individuals go from 0 or 10% service connected disability to 70 or higher. And it's not that it's a game or a scam or anything like that. It is that many times it is really hard to predict how someone's military related injury or affliction is going to affect their body as they age. And so many times it is in ways that weren't expected, but they are able to be, we as individuals are now able to connect the dots. We can connect that disability to the service that they were providing. And so many times we've seen veterans who were surprised that they wouldn't have suffered from this but for their service. So don't let there be boundaries that really don't exist. If you believe that you have a service-connected disability uh, of 5% or 500%, don't let that stop you because as veterans, you deserve the opportunity to know what all of your options are.
Very, very well put, and I'm glad to get that out to people. When in doubt, ask. When in doubt, call us, and we will do our best to provide direction for people to get their questions answered or to just reassess whatever the path forward might be. So I'd like to thank the viewers for watching our program tonight, and I'd like to thank you, pardon me, for taking part in our program. Many of you had very, very good questions. And if you are viewing this program when it might be replayed and we're not on the air to take your call, again, our number is 937-223-4613. You'll get our message machine, but we will call you back. It's extremely high priority for us. So thank you for participating in this show and talk to all the veterans you know. Thank you very much. We
Thank
enjoyed it.
you.
Thank you, Chip.
You bet.
Thank you, DATV.